It is 4:02, so I will call the meeting to order. And to board members, I need a agenda approval before we move on. Uh, Reno and Ed, all in favor? Opposed, that's carried. Thank you very much. Any conflict of interest on the agenda as presented to you this afternoon? Hearing none, we'll have that reflected in the minutes. Well, it gives me pleasure and to introduce our new board member from the as a provincial appointee, Robert Mauch. Mage.
Hello.
Okay, I can't see him.
I put my camera on. I know it's supposed to have it off, so I didn't want to crowd the screen, but I should be visible now.
Well, exactly, and then so now we can put a face and a name, and so give you a proper welcome to our board. We've been waiting patiently for a long time for our provincial appointees, and so welcome aboard, and looking forward to working with you and with all of our senior management team and rank and file folks at the health unit. And it's nice to see our board ranks start to increase again, and certainly we want to welcome you to the board.
Thank you, and I look forward to working with all of you.
Great. And also, we have also other introduction, but maybe doesn't need any introductions. But I don't know if Nicole, you want to introduce our new interim director of health protection, but no, he's no stranger to the board. But I'll just let you introduce your new.
Sure. Yeah, just so as everyone is aware, with my transition to the position of CEO, we were recruiting for an interim director of health promotion. There's a typo on the package, so it is interim director of health promotion, and he is no stranger to the board. He's presented many times, so many of you will probably be aware of him and have heard his name, Eric Nadalin, and he doesn't have his video on, but he will be. He is on the agenda, so he's kicking us off tonight on the agenda as well. So you'll see him later.
Okay, well, certainly. Well, Eric, if you want to, put your camera on, don't be shy.
Yeah, my camera's on, Mr. Chair, and
there we go.
I think it just needed me to say something, which has never been an issue for me. So, thank you for the warm introduction. I've been at the health unit for a long time now, and been managing the chronic disease and injury prevention department for just over 5 years, and excited to be a part of this group. So, thank you.
All right, so congratulations, and certainly looking forward to working with you at JBEC and to continue further the items and issues that confront us in moving forward for the public health safety of all of our residents in Windsor-Essex and Pelee Island. So welcome aboard.
Thank you.
All right, we'll move on to 5.1, the COVID-19 update. Dr. Ahmed.
Thank you, Mr. Chair. I would put slide deck just for us to follow the follow my data, which would be easier. Let me see how I can do that. Okay, so I'll just quickly go through what's happening with COVID in the world and where we stand in Canada. As you can see that the COVID cases in Canada is declining, but we are seeing increase in some of the other countries such as Spain, France, and UK. UK increase has been really marked, and despite having a high vaccination rate, they are seeing that their cases are continuing to increase in their region. Some of the other countries followed the same path, Spain and France mainly, and their cases are increasing at a rapid rate. which is definitely a cause of concern with respect to the COVID pandemic response. What is driving many of these cases is the Delta variant that we all are aware of. The Delta variant is the virus that was first found in India and continue to dominate the variant of the different type of viruses that we are seeing in other countries. Majority of the cases that are seeing in UK, almost more than 80, close to 90%, is the Delta variant, and US is also seeing an increase, which is the Delta variant, and they're all close to 80%. Canada, we're still at a between somewhere in 15 to 20% range, but recognizing that that variant is spreading, and if we follow the same trajectory that we are seeing in some of these other countries, Delta will be the most dominant virus that we will see in our country as well. What is interesting to note that because of the high vaccination and despite the increase in the cases, the UK and Spain and France, they're not seeing the same magnitude of hospitalized patients in COVID-19. So that's one way to say that the vaccines are definitely helping to reduce the severity of the disease, and majority of the cases that we are seeing in these countries are in individuals that are not fully vaccinated. So a couple of key lessons is, one is the people who have received the vaccine, and even if they get sick, they are not getting severely sick to get hospitalized. And those who are getting the disease mainly are individuals who are unvaccinated. So now switching gears and focusing only in Ontario. So in Ontario, we are seeing a steady decline of cases as after the third wave is officially over, and we are continuing to follow the same trajectory where the cases continue to decline and stabilizing. In Windsor-Essex, we are seeing the same pattern, but more so than the province, and we continue to see a steady decline in overall COVID cases in our community. Reflecting that by week over week case rates. So we are talking about our most recent weekly case rate. It's sitting at 1.6 cases per 100,000 population. And this is obviously a decrease from where we were last week. And looking at the past 7 days, our rate is 2.3 cases per 100,000 population. So this is also a decrease from last week. So overall, we are moving in the right direction, and we just need to make sure that we continue to maintain that trajectory and continue to vaccinate our people. We pretty much avoided the third wave to the larger extent by due to the successful vaccination campaign. And as we continue to vaccinate our community, we are moving in the right direction, but something that we always have to be cautious of is the increase in other countries and how things can change very quickly from us being in a better position into going down the same pathway, which with increased number of cases. So with respect to all the tests that are being conducted, we are conducting roughly around anywhere between 3,500 to 4,000 tests a day. And our person positivity that is coming out from these tests is at 0.5%. And this is by far the lowest person positivity that we have seen since the beginning of the pandemic in March 2020. So we are, again, doing much better with respect to the person positivity in Windsor-Essex. So where these cases are, and if we just break it down with respect to the municipality by municipality from July to present, we are City of Windsor, obviously with the most densely populated city in the region. It has the highest number of cases, followed by Kingsville and Tecumseh, and the rest of the municipalities also have some cases, with Essex and LaSalle reporting no cases since July. And a similar picture, what we can see here in the last 30 days, we continue to see that City of Windsor dominating mainly 3 out of every 4 cases of COVID in the region, and the rest of the municipalities have a smaller share of COVID-19 cases since in the last 30 days. With respect to the age and sex distribution of these individuals who have been impacted in the last 2 weeks, the majority of the case, almost 44% have been in between the 0 to 29 age band. And when we are looking at some of the causes, the majority of these, our vaccination rate is the lowest in these two age band. And so we can relate that having a low vaccination rate and more cases in that age group is definitely something that would prompt the need to increase vaccination rate in each in these age bands. So something that we continue to push with our messaging, with our work more recently, encouraging young adults to get their vaccine, encouraging 12 to 17 years who are eligible to receive the vaccine to get the vaccine. With respect to where these individuals are acquiring the disease, it's almost half of these cases are acquired in the community setting. And when we say the community setting, that means that they are not linked with a confirmed case, or at least not to their knowledge. And they contracted COVID just being out in the community. So, and again, a reminder that when you are outside, there are ways that you can still contract COVID, even not meeting anyone who's apparently sick. So taking precautions every time you're in the public is something that we all have to do to ensure that we are not contributing to the further spread of the disease. And also, if we are vaccinated, we are breaking that chain of transmission as well. The impact of COVID on hospitalization has continued to decrease, and the hospitalization number is in the decreasing everywhere in the province as well as in the region. Similar picture of COVID-19 cases in the ICU is declining everywhere. When it comes to how quickly our cases are increasing, so doubling time, day-over-day comparison. And just as a context, if you have a higher number or a high doubling time, that means you're doing better, and it's taking much longer for the case to increase in double the number that we have today. So overall, Windsor-Essex is doubling time is increasing. Overall, the doubling time for Canada and Ontario is increasing. We're on the right path, and the effect is much more pronounced in Windsor-Essex compared to the province and in Canada. With respect to the median R0 or the median reproductive rate, it is currently estimated at 1.39, and this is higher from last week when we were at 0.99. And as we have always said, that when the R0 is higher than 1, that means each existing infection is leading to more than one new infection. So obviously, right now, our R0 is 1.39. So that is giving us an indication that the cases are increasing slightly. But because of the very low number, we are reporting 2 cases, 3 cases a day, and some days we are not reporting any new cases. So that's causing the variability and stability of the R0 data. And so we can't necessarily interpret the same answers if the R0 is higher with the low case count. So just as a word of caution, I wanted to mention that. So now switching gear, talking about the vaccine status and looking at the global picture where we are with respect to the COVID-19 vaccine given and at least 1 dose. So Canada is obviously leading many nations with their first dose, even higher than Israel and UK. That has been regarded as the success story with the COVID-19 vaccination program. And when we are looking at people who are fully vaccinated, Canada is increasing rapidly to take the lead again with people who are fully vaccinated. And we have exceeded the US with respect to the fully vaccinated population. And we are on track to exceed the UK in the next few days. So hopefully by next week, we will be in a position that we will be behind only after Israel, and at some point, maybe we'll surpass that as well. The number of vaccine that is being administered in Windsor-Essex by dose and by in our average, we're seeing a decline in the daily doses administered, and that's evident in both these lines of red line and yellow line, which is giving us a 7-day moving average. for the first dose and the second dose. So first dose is relatively stable, and people are getting the first dose vaccine. Up to 10 to 20% of our daily doses are given as a first dose, while the majority is then given it as the second dose. But overall, when we are looking, we are administering at least roughly around 2,500 second doses on an average, and roughly around 490 doses on an average every day. So still, we need to increase the vaccination rate. We have the capacity in the system. We have the vaccines available for people to receive even same-day appointment to get the vaccine. So it is slowing down. We are hitting a saturation point, but something that also highlights the importance of all of us working together to increase the vaccination rate to avoid any potential fourth wave, and also avoid any surge in the Delta cases as UK and Spain and France and some of the other countries are seeing. So looking at the overall cumulative doses, and as we can see, there's a steep increase in the number of doses that is being given out, and it continues to increase, and we'd like to see that a trajectory going on to fully vaccinate our residents in the region. So this graph basically shows you this different saturation point, and whether the number of doses are increasing in each of these age bands. We can see that among the higher age band, we are seeing more of a plateauing effect in the vaccine uptake, whereas the younger age band, we continue to see increase, but not at the pace that we'd like to see. It is slowing down, and we'd like to see that increase. So similar picture with respect to the second fully vaccinated people. We are seeing some plateauing in the older age group, but the younger age group, we continue to see an increased uptake in the second dose, and we just need to follow that trajectory. So this is a new graph that we have put together especially for the city of Windsor, and to look at the vaccine coverage rate by the forward sortation area in the city. And what we are looking at is the vaccination coverage rate, and in different shades of to identify the coverage rate. And the green is obviously a region that has the highest vaccination rate in this particular graph, with at least first dose, and followed by blue, then orange, purple, and then red is the area with lower vaccination rate. So this is at the FSA level. And then what we have done is we have mapped in the mass vaccination sites in each of these regions to give you an indication from an access perspective that how these individuals are accessing these clinics. So we have a mass vaccination sites that are identified by a pentagon in blue color, which is identifying where these mass vaccination sites are. And in this particular graph, you can see that we have 2 mass vaccination sites that are operating. And then we have the pharmacy, which is indicated by a dot. And everywhere you're seeing a dot is identifying a pharmacy that is giving out the vaccine. And then we have done many pop-up and mobile clinic, which is the green square that you can see in this graph. And mainly these green squares are in the area which has the lowest vaccination in these regions. So we continue to look at the data again, and trying to work with our partners through the high priority community strategy, working with local physicians, and to offer pop-up mobile clinics for these areas. On this graph, we also have a triangle, a yellow triangle, and that's basically just giving you a primary care physician that is also giving out the vaccine. So similar picture with the same notation, and then going on and talking about these fully vaccinated, or people who are fully vaccinated with 2 doses. So not a lot of difference, but just as an indication that there are some regions that will require ongoing support and efforts to increase the vaccination in these FSA areas. So with regards to the vaccine type, obviously we have stopped giving out AstraZeneca as the first dose, and with the preferential recommendation from NACI to give an mRNA vaccine after the AstraZeneca dose, we are only giving out the mRNA vaccine, which is the Pfizer-BioNTech and Moderna vaccine. And depending on the supply, we are offering each of these vaccines in our clinic. We've had some supply challenges, but that challenges is over. We have plenty of Pfizer vaccine. We have plenty of Moderna vaccine. So there is no reason for people to wait to get the vaccine that they need, and they can get the vaccine. And in the past, even when we were talking about these vaccines, the mixing and matching of vaccine is safe and is an effective way of continuing to vaccinate our resident and prevent any ongoing transmission. So we have received a huge success with every public health measure that we have put forward by early vaccinating people, and even with using the mixing and matching to ensure that our residents are fully protected, and that helped us to prevent a third wave in our community. So we are on track, and we are definitely don't want to see any fourth wave coming to our region. And we are hoping that we can increase the vaccination rate in all of our neighborhoods and in all of the age band to continue to stay open without any need for curtailing some of these or adding any of these restrictions in our region. So in summary, we continue to see that cases are declining in Windsor-Essex. Hospitalization is also declining and continues to stay low. Our first dose vaccination coverage rate is 65.7%, and that includes everyone, including those children who are not even eligible to receive the vaccine. Similarly, second dose vaccination coverage rate is 55%, a slight increase from last week as well. With respect to the monitoring indicators, the most recent completed weekly case rate, as I mentioned, is 1.6 cases per 100,000 population. This is by far the lowest weekly case rate that we have seen throughout this pandemic. So thanks to the success of the vaccination and public following the public health measures. And our most recent 7-day rate has seen a slight increase, but not to a level that we can are concerned at this time. It continues to stay at 2.3 cases, which is, again, overall, it is a low number as we have seen in the past. Our person positivity is 0.5%, which is great. And the most recent 7 days person positivity is 0.66. Our not effective, as I mentioned, is I think there's a typo here. It's not 0.99. It was slightly more than 1.29, and indicating that the cases are slightly increasing in our community, not to a level, again, that would raise any concern. There are no active outbreaks in the region, and we have our vaccination coverage rate for adults is increasing, and we continue to vaccinate our people with full 2 doses, but that number needs to increase. We'd like to see a minimum of at least 80% of our residents fully vaccinated. The goal is, if we can get to 90%, that's the ideal goal, but 80% would be the minimum number coverage that I would like to see for our region. So I'll stop here, and we're happy to answer any question.
Thank you very much for your report, Dr. Ahmed. Any questions to Dr. Ahmed at this time? Yes, Tracy.
Thank you. Related only somewhat, I guess, but just a question. So I know that we have an increase now of the pop-up clinics that are happening in communities, and we had one occur today in Comber. There were a lot of questions around how many times a child could be vaccinated and how we're tracking. And the reason for that is that there are prizes at stake because we're trying to reach that more vulnerable population that may or may not come. So those prizes being at stake, and then as well as not needing identification, not needing an OHIP card, and not needing parental permission. So the question is, will somebody go in more than once? Could they be vaccinated multiple times? And how are we tracking to know indeed that they've already had it?
So I'll try to answer, and maybe Nicole or Christy want to jump in. But so regardless of not needing any kind of health card, they have to be registered in the system. So if an individual cannot be registered in the system twice, I think to my understanding, and Christy and Nicole can correct me if I'm wrong, we at least need some kind of a proof like that shows their ID, whether it's a school card or anything that can help us to identify that individual. So once we do that, so we would eliminate the risk of giving them vaccine, more than one vaccine if they don't need that. So that's the goal, and hopefully that we're removing many of these barriers, but we also want to make sure that we are not causing any medical error or any other type of error, just to remove that barrier.
Supplementary, Tracy?
Thank you. Yes, I guess just a little bit further. So are we using a unique identifier? So when they're being registered, we are. Okay, awesome. Thank you.
All right, thanks. Judy? I think you're muted. Okay, well, I'll go back to Judy. Ed? And then Gary Keshak.
Can you hear me?
Yes, we can.
Okay, great. Thank you. Like I know we have a lot of challenges ahead of us. Most of the challenges I think can be really resolved if we maybe possibly take a tough action. Like some parents, they don't want to vaccinate themselves. They don't want their children to be vaccinated. And here it is, we try and we try again. It's just sometimes it doesn't seem to work. And my question to Dr. Ahmed, do we have the power, or at least our health unit here, do we have the power to call the employer and ask and tell them if one particular employee or bunch of them, they did not get the vaccine, just don't get them back to work? Do we have this power here?
So the short answer is mandatory vaccine is not something that has been used in Canada at any level for any place. The only thing that we see even in the Immunization of School Peoples Act is for them to get the vaccine and provide a record of that vaccination. They can choose not to get the vaccine, but they have to go through an educational session and then basically sign off on a document saying that despite all of that, they have the reason not to get the vaccine. And when we are in an outbreak situation, those individuals or those children are excluded from attending the school. So moving forward, what we can anticipate that a workplace with a lower vaccination rate, or a lot of people with no vaccination, we can expect that those workplaces can go into outbreak, and then as a result of that outbreak and the potential risk to that workplace, it would be under our authority to close down the workplace to prevent further transmission. And that would be something that none of these businesses would want. And the businesses as an employer, they can set up conditions for employment, just like, for people to do a job, they have to have certain level of designation, qualification to do the job. There can be requirement from the employer to ensure that if their if their workers are vaccinated or not. So those are some of the rationale, and any kind of mandatory vaccination policy, if and when it comes, it will probably come from the province rather than at the local level, but the employers will always have the option to have these requirements based on their business need and to make sure that they continue to stay operational. And the guidelines are changing, that even in the event of an outbreak, if someone who's fully vaccinated and if they are asymptomatic, they may be allowed to continue to stay on work. But for those, if they have a large portion of people who are unvaccinated, it would be a hazard, and public health may take action to close those facilities.
Dr. Ahmed, I want to thank you very much. Thanks, Gary.
Okay, thank you, Ed. Gary Keshak.
Thanks very much, Chair, and good afternoon, everyone. Just to piggyback on Councillor Sleeman's question there, I represent the N8T region of Windsor, and the levels of vaccine are low there. But I did have somebody just tell me that they have never given their child any kind of vaccine at all ever, and they've actually got letters from lawyers and notarized that they don't have to do that. So that sort of surprised me, and I'm just wondering what kind of percentages do we know from public health? How many of these people are out in our community that have no school vaccinations and are, no intention of getting the COVID vaccine?
So we can speak about other vaccines that we require under the Immunization of School People's Act, and it depends on the vaccine to vaccine. If we use the measles, mumps, or rubella vaccine as an indicator, we've got a pretty good coverage rate. We have got, depending on the cohorts, we have even coverage rate up to 96% in some of the age cohorts. But on an average, I can say that if I recall correctly, it was close to 92%. So it really depends on vaccine types as well, that how many of these people who are choosing to get an exemption. As far as the risk to these children are concerned, these risks obviously will be much higher. And people who are making that decision, they will be putting their children at risk, because we know if we start to see some increase in the Delta variant, it will spread very quickly. And the schools, as we are trying to ensure that the school continue to stay open, and when it stays open, large number of unvaccinated kids, large number of people who are unvaccinated, they have the potential to continue with this spread. So we definitely don't want to shut down any schools. We definitely don't want to dismiss any cohorts. Same idea that if you have large number of kids who are unvaccinated, they will definitely be excluded. And those who are fully vaccinated, depending on their risk, they may be allowed to continue to stay in the school for their education. So there is some risk and benefit of people who are choosing to do that. But overall, we have got a pretty good response for some of these mandatory vaccine, but it varies from cohort to cohort and by vaccine type.
Well explained, Dr. Ahmed, and I appreciate that. And so, we do have a small percentage of people in Windsor-Essex County that do have these legal exemptions. That's interesting for sure. I definitely want to thank you and Nicole and the health unit for the two recent pop-up units here in the Fontainebleau area. One at the Grandview Community Center there, and one at William Davis School yesterday. And I hope they're well attended. I know there's another one at William Davis School next week, and also one at St. Teresa School in my ward next week. And I appreciate the reaching out and doing that for the area. Any report of good numbers yesterday at that, or can you say ballpark figures or anything like that at the Davis School?
I will say that the numbers weren't as high as we had hoped. So, we're well, and Christy could speak more, but you probably saw a media release go out, and I know Dr. Ahmed has spoken a number of times to the media yesterday. We're just trying to encourage people and raise awareness about those opportunities. So we're hoping that next week's event in your area will be, much more well attended. But it was the first one. The one at Davis was the first one. So again, we're doing more to encourage.
That's fair, Nicole, and I appreciate that. And I think that's what happened is, the next two for next week were announced, and I think people said, "Well, I got three options here now," and the the sense of urgency wasn't quite there as much. But so I'm hoping that the two next week will fill up, and we'll reach our numbers a little bit higher as well. So thanks again, Nicole, and this is your first official meeting as CEO, and congratulations.
Oh, thank you.
Thanks, Chair.
All right, thank you, Gary. Before I move to Robert, I'll go back to Judy to see if she's back.
She typed in the chat, Gary. So
go ahead.
Yeah, so she says, this is for Dr. Ahmed, with the resurgence in Great Britain seeing a concerning rate of hospitalization, serious illness with the Delta variant. So asking if they did see any serious impact, and is their situation a concern as they have had a good vaccination rate?
Yeah, no, great question, Judy. What we are seeing is obviously an increase in the hospitalization and serious illness with Delta variant among those who are unvaccinated. So anyone who's unvaccinated and they're contracting the virus, they are getting hospitalized and they are getting the severe disease. It's not the same because obviously when we're seeing that increase, they may still be positive for COVID, but the severity of the disease for those who are vaccinated is really low. So the risk is mainly for people who are unvaccinated. And but if we have a system, if we have a large number of population that are unvaccinated, what we are doing is we are giving an opportunity to this virus to continue to replicate and continue to spread. And when it's replicating, that's when some of these mutation happens. And if it mutates into something really dangerous, which could be, which would not respond well to the vaccine, we'll be in a big trouble. So even with fully vaccinated people, you can expect, even if it's say 92% effective against Delta variant, you still have 8%. So and when we're talking about roughly around 8 to 10%, that's a significant number. We're talking about at least 40,000, 50,000 people who are vaccinated. Scratch that number. But let's say even like thousands of people who will be vaccinated, but they'll still get infected. So in order for us to prevent the chain of transmission, first of all, we'd like everyone to get the vaccine. So even if they get infected, they won't get seriously impacted by it. And secondly, they won't contribute much to the spread of the disease. So now we are getting some of the initial data that is basically saying that if you're vaccinated, the likelihood of you spreading it further is low. So overall, from a public health benefit perspective, vaccination is the key. Everyone needs to get the vaccine. We need a very high vaccination rate in our region. And some of these public health measures continue to be in place, especially in indoor setting, to not to allow this virus replicating unchecked in our community.
Okay. I think you can hear me now. Sorry, I was having problems earlier. Appreciate that. Thank you.
All right, I'll go to Robert.
Thank you. I'll turn my camera back on for the question. For Dr. Ahmed, and it's very much in follow-up to Tracy Bailey's question about the unique identifier. My question is that unique identifier constructed in such a manner that it is able to defeat an individual who attempts to purposefully acquire a third vaccine? And the reason I ask that is for a host of invalid reasons, such as deciding, for instance, I'm first vaccinated AstraZeneca. I'm fine with that. I understand the science behind it, but some may decide that they need 2 RMA vaccines on top of that. And of course, there's a complicating possibility that the Americans will not recognize the AZ vaccines for visiting the United States in the future. And I don't think we have data. I've been following the Lancet fairly carefully. I don't see data indicating 3 is safe yet. And I don't want to be part of that cohort to decide that. But are we able to defend against that type of potential abuse?
Yeah, no, thank you for the question. And that's the whole purpose of having that unique identifier, is to prevent anyone from accessing a vaccine either at a shorter interval, which would also invalidate the vaccine, and also for people not to get the vaccine if they don't need to. If they're already fully vaccinated, they won't be able to get the vaccine. These unique identifier is created by the health unit, and we are obviously monitoring that every time a nurse or someone who's giving out these vaccine, they go into the COVAX system, they verify all that information, and then give out the vaccine if they're eligible to receive that vaccination dose.
By way of supplementary is, are we able to guard against an individual using a false identity to create yet another unique identifier to attempt to create a record of 2 mRNA vaccines, US approved mRNA vaccines, or otherwise?
So, and maybe, I don't know if Christy or Nicole want to chime in, but I think obviously with the various reasons, if someone wants to really trick the system, some people are creative and they can come up with a creative solution. The idea for us to have any kind of ID is also to validate that you're not just providing that information by making up your own a different name or a date of birth, because those are the two identifier that is initially used to link those people. And with having a proper ID, we are trying to eliminate that chance. But I can never say never. There are always people who try to trick the system, but our system in place is trying to mitigate all of those effects as much as we can.
Thank you. It sounds very carefully put together.
All right, thank you. Okay, I still see, or maybe it's from the former question, but Gary Kashak, your hand's up, or do you want another question?
Sorry, Chair, I forgot to remove it. All set. I'm good now. Thanks.
Okay, and Judy, you're okay too, or do you have another question?
Sorry, I do have another question. Thank you,
Okay.
Chair. My question is that with the reopening of the border, and we're all concerned about business and economy and that, I guess what I'm wondering when you're talking about people falsifying and looking for ways to go for a third vaccine, questions have arisen to me about what type of, is there discussion going on with the health units about what type of identification will be required to ensure that if they're opening the border to people who are fully vaccinated, that there's some type of system that's legitimate in place? I mean, I've got a printout that shows that I got my vaccines, but quite frankly, I could make that printout just as easily. So just wondering if there's any discussions going on with the health units, with the province or the feds as to what type of identification they're looking at to ensure these are legitimate, that people are actually vaccinated that are coming across, particularly now with the Delta variant and other variants possibly developing.
So great question, Judy. Short answer is no, we're not involved in any of these discussions of how they validate that information. And that was always been the question, that how you will use that information to validate the vaccination, because part of that is the comment going back to the concept of vaccine passport, that if can there be any proof that can be used internationally to identify individuals who are vaccinated rather than a piece of paper, because anyone can provide that piece of paper. The other safeguard on top of that is obviously is the risk mitigation piece, that they also have to have a negative COVID test to enter Canada. Not sure what it would look like for the land border if and when it's open. I think the requirement will continue to be there. But I hear you. That's why it is critical that we have a good system for validating these vaccination record and the COVID testing that is needed for people to enter our country.
Okay, thank you.
Okay, I don't see any further hands up. I think Judy, you can take lower your hand. Thank you. If there's no further questions, then I'm going to call upon a resolution to receive Dr. Ahmed's report. Reno and Joe, all in favor? Opposed, if any? That is carried. Thank you. Thank you very much, Dr. Ahmed, for an in-depth report. And we'll move on to the approval of minutes of regular board meeting June 17th. Can I have a motion on those minutes? Gary and Ed, on those minutes, any errors or omissions? Hearing none. All in favor? Opposed? That is carried. Business arising, I believe, Nicole, you got 7.1, the consumption and treatment services site update.
Yeah, so there's no a report this time, and I'll be brief. We just committed to continuing to bring an update to our Board of Health in regards to the consumption treatment services. So we are underway with our consultation, as you were all aware, on 2 potential sites. Our survey is out there. We've had over 700 responses. We are also planning upcoming town halls as well with a panel of guests and trying, every different avenue to ensure that we get engagement, in particular for the residents and businesses that surround the sites that we're looking at. We hope to bring a more formal report to the board in September. So, and that'll have the results of the consultation, as well as hopefully a site that we may have selected. And then from there, we'll be going for approval, obviously, to the city. But just giving an update that we're in the midst of consultation, and that'll take us into August. And then we'll be looking at analyzing all of our results and bringing forward a report and making some decisions.
Okay. Any further questions? Any questions on that? I just want to thank Rena Bordelin, or Councillor Bordelin. I know it's in your area, and I know you've been very active within that community and kind of spearheading this very issue that's really critical and important to obviously for our region. So I want to just extend my thanks to you. Okay, we'll move on to consent agenda. The information, we have June communications recap. Make avail yourselves of that. It's in your packages. And then the resolution. So if I could have a motion on the consent agenda. Gary and Judy. All right. All in favor? Oppose? That is carried. On those, in particular, some of them on the resolution, is there anything of interest that certainly I think you'd like to bring forward? I know we have the 2020 annual financial statements. I think I'm going to ask Lori, maybe if you can give us an update on that. And also the active school travel charter for the regions Windsor-Essex. Eric.
Okay, thank you, Board Chair. I'm just going to share my screen, so I just ask for everybody's patience. Okay. All right. So I have a very brief presentation in regards to the 2020 annual audited financial statements. I apologize, I cannot get it to go into present mode without it flipping onto a different screen. The recommendation and resolution report that you have before you, and included in page 11 of the board package, are the audited financial statements for the Windsor-Essex County Health Unit for the year ended December 31, 2020, as well as the financial statements for the Windsor-Essex County Health Unit Ministry of Children, Community and Social Services Program Initiatives for the year ended March 31st, 2021. The financial statements for the Windsor-Essex County Health Unit can be found on pages 15 to 47 of your board package, and there are some key highlights that I'll go through. At December 31st, 2020, $1,445,661 was owed to the Ministry of Health for settlements related to the 2018, 2019, and 2020 fiscal years. In July of 2021, the Ministry of Health communicated that the 2018 settlement review was concluded and that those amounts would be clawed back in July. Settlements for the 2019 and 2020 periods remain under review, and with the 2020 settlement having been submitted on June 30th of this year. Due to municipalities at December 31st, 2020 amounted to $3,831,708. Similar to the amounts due to the Ministry of Health, these funds relate to the 2018, 2019, and 2020 settlement periods. Presently, the 2018 funds are being refunded to the municipalities due to the conclusion of the review of the 2018 settlement with the Ministry of Health. Regarding the 2020 settlement, a detailed calculation of the settlement figures are found within the recommendation report. Key points to note for all board members are: on January 1, 2020, the change in the funding model came into effect. The Ministry of Health would provide the WICHU with a grant of up to 70% of admissible expenditures to a maximum of $15,981,600. The obligating municipalities would be responsible for 30% or more of the remaining admissible expenditures. In response to the change in the funding model, the Ministry of Health approved multi-year funding to mitigate the impact of the change in percentages that the municipalities would bear. For the Windsor-Essex County Health Unit for the 2020 fiscal year, that amount was $1,260,800. The Ministry of Health provided one-time funding for extraordinary costs associated with COVID response. This funding was available to public health units for dollars expended in excess of their mandatory program budget. For 2020, the threshold for Windsor-Essex County Health Unit in terms of admissible expenditures was $22,830,857. In total, the Windsor-Essex County Health Unit's admissible expenditures for the December 31, 2020 fiscal year were $23,072,778. As total admissible expenditures exceeded the $22.8 million threshold set by the ministry, we were entitled to receive a total grant for mandatory programs of $14,981,600. Additionally, and due to the fact that admissible expenditures again exceeded the $22.8 million threshold, the WECHU was also eligible to receive $241,291 of additional funding associated with COVID extraordinary costs. Lastly, and again, because the threshold was exceeded, the WECHU also was in receipt of $1.2 million in mitigation funding, which will be flowed through to the municipalities upon final review of the 2020 settlement. I'll briefly touch on the statements associated with the programs funded by the Ministry of Children, Community and Social Services. As you may recall, these programs include the Healthy Babies, Healthy Children's program and our nurse practitioner program. These financials can be found on pages 48 to 69 of your board package. Of noteworthy mention is the fact that $581,637, representing the amount due to the Ministry of Children, Community and Social Services, is the settlement for the 2020 year alone. Similar to other programs administered by the health unit in 2020, it was negatively impacted by the COVID pandemic. As presented to the board in May of 2021, the WECHU has established a service delivery plan to meet full program implementation for the 2021-2022 fiscal year. So to my final slide for today, and in order to finalize the financial statements, I have compiled the recommendation as you can see on your screen. So whereas at the July 15th, 2021 meeting of the Audit Committee, the financial statements were reviewed and recommended for approval to the board, and now and therefore it be resolved that the Windsor-Essex County Health Unit Board of Health approve the annual financial statements for the Windsor-Essex County Health Unit for the year ended December 31, 2020, and the annual audited financial statements for the Windsor-Essex County Health Unit Ministry of Children, Community and Social Services programs initiatives for the year ended March 31, 2021. So board chair, I'm just going to stop sharing my screen. And if anyone has any questions, I'd be happy to take them at this point.
All right, thank you very much, Lori. Any questions to Lori? I see none. Then a motion then to adopt the report. Tracy, Ed, all in favor? Opposed, if any? That is carried. Thank you, Lori.
Thank you.
All right, now we'll move on to Eric.
Thank you, Mr. Chair. So as this group knows, the Health Unit has a long-standing history of supporting active transportation initiatives in our community, be that through its membership on the steering committee of the countywide active transportation system, or through the Windsor Bicycling Committee, or through advocacy to local or provincial decision makers for increased AT infrastructure. The board may recall an information report that was shared at the February meeting related to our successful application for a Ontario Active School Travel Grant, where we received $60,000 in funding to conduct AT initiatives with 6 pilot schools in our region. This resolution is related to one of the tangible actions of that steering committee of the OAST grant, which consists of the 3 school boards, Windsor-Essex Student Transportation Services, the City of Windsor, Police Services, Bike Windsor-Essex, as well as the County of Essex. And one of the key actionables of the grant was to create an active school travel charter that could be shared with municipal and school-based decision makers. And the resolution in front of the board is that the Windsor-Essex County Board of Health supports the Windsor-Essex County Health Unit in presenting active school travel initiatives and the active school travel charter, which is attached to your board package, to local municipalities and school boards in order for these key stakeholders to endorse these initiatives and adopt a regional active school travel charter for Windsor-Essex County. So I'm happy to answer any questions related to that resolution.
Okay. So the request is for the board to adopt the charter.
Well, anytime you get monies given for programs, we gladly accept. Okay, do I have on the recommendation to support this recommendation? Do I have a mover and a seconder? There we go. Now I can see people. Larry and Joe. All in favor? Opposed, if any, that is carried. Thank you, Eric. New business, CEO quarterly compliance. That's our April 2021 to June. And this will be your first one, but kind of a hybrid. So to you, Nicole.
Yep, so you'll find the report in your board package as the chair stated, it's for April to June. So you'll see that it was signed actually by Lori, Dan, and myself, because it reflects the CEO period of which Teresa Marintet was the CEO. And your next report will be my first official report. But if you have any questions, we're happy to answer them.
Yeah, I was just going to ask if there's anything you want to highlight or some highlights or points of interest, and then I'll certainly open it up to the board. Any questions?
Nothing to highlight other than noting there was a different signatures on there.
Okay. Any questions, members of the board? Then I motion to receive the report. Judy and Gary, all in favor? Opposed, if any, that is carried. Thank you. All right, if I could have a motion to receive the correspondence, we have 8 correspondence. If I could have a motion to receive. Judy, Ed, all in favor? Opposed, if any, that is carried. I don't know if there's anything that the board is interested in bringing forward on any of those communications. Okay, hearing none, we'll move on to, I believe we need to move into the committee of the whole, closed session in accordance with section 239 of the Municipal Act. Motion to move in camera. Judy and Gary, all in favor? Opposed, if any, that is carried.